cell phone. If you need to get a hold of us, you can ask questions anytime. You can hopefully making appointments online. If you have access to internet, you can go ahead and just pick a day. You'll be able to log on as a benefactor. You'll have access. You can actually pick a day, time, fill in your name, and it goes right onto our schedule. Again, 300 to 2,600. That's an average. 2,600 is the average for a primary care office for an individual provider to have as a patient population. So in order for me to support myself as a family physician in the insurance system, I have to have a patient population of about 2,600. All right? And so it's very difficult to know all of those patients on an intimate one-on-one basis. But what we're going to do as physicians, we're going to limit our patient population to 300, okay? So we will choose, each of us will have a patient population of 300, so 600 for the whole clinic. And what that enables us to do is to do that individual care, same-day access, 24-hour access, all those benefits, because we're only dealing with 300 people who we will know well, okay? But that will take up half of our time. The other half of our time then will be spent caring for the uninsured. So, and again, 48 weeks out of the year will be available. We will take vacation. Trust me, you want your doctor to take a vacation every once in a while. Benefactor levels. This is the important thing everybody wants to know and write down, but it's on the sheets there in front of you, so you'll have it. But benefactor level, $1,200 for an individual. If you're a single person, you want to support the clinic and you want to be seen as a patient, you pay a one-time-a-year fee of $1,200, and that's it for the year. A couple would be $2,300, and again, we make some adjustment for ages. Excuse me. The big thing is that, as we get older, we cost more. So we will make some adjustments for that. Over age 60, we add 100 or add 300, and below 35, we subtract 300. Kids, $500 for the first 3 children. So if you're in a family, you have 6 children, then you're only paying for the first 3. Okay. So, and again, same for the full-time student who's less than 23. That would mean that if you're a couple with a large family, you're talking about a family price of about $3,800 to be benefactors. So, what services we provide as a family medicine clinic? We are primary care. We care for newborns, kids throughout all ages, adult medicine, elderly care, the whole gamut of things. We will do newborn exams and screenings and so forth. So, Ann and I are both particularly interested in women's health, but it's not the only thing we do. We are family medicine trained. So, but we do fertility appreciation, NFP. Particularly, we do Creighton model training, the Creighton model fertility care system, which is a system of natural family planning. So we have an interest in that, and it doesn't by any means limit us to only doing that. Inpatient care, we'll do rounds at St. Mary's and Meritor, and so we'll be also doing inpatient care. Labs in our office, we'll keep our labs simple, because the more labs you do, the more personnel you need. The more personnel you need, the higher the cost for your overhead. So in order to keep our overhead low, we're going to keep our personnel low, and that'll keep us streamlined. But we will do some simple tabletop labs, urinalysis, blood glucose, and urine pregnancy, hemocol. So simple things in the lab. I'm going to have Ann do some, if you don't mind.
Okay, we're going to change gears a little bit here. And then Michael's going to go back and talk about the benefactors again. But I'm going to talk about recipients a little bit. Because a goal of our clinic is to provide care for the uninsured or the needy. And this is in keeping with Catholic healthcare tradition. That's a huge part of Catholic healthcare is caring for those who can't get help otherwise. But people ask me, do we really need Is there a need for that in Madison? There's Access Community Health Center, there's other places. Do we really need that? So I'm going to kind of go through that and say why, yes, we do need more health care for the uninsured, and I think there's going to be more of a need as time goes on. This is just for the state of Wisconsin, showing who is uninsured for part or all of the year, which is nearly 10%. So any given day, about 1 in 10 people in the state of Wisconsin does not have health insurance coverage. And here are some numbers. I guess I said that wrong, 8% at any given time. But percentages change significantly with different demographics. So if you look here at the not poor on the right, that's a pretty small number. And those people who are uninsured are people who probably could be insured if they wanted to, but they choose not to spend their money for health insurance. But if you look at the poor people on the left and the near poor, almost 20% of the poor people who are the uninsured. I'm saying this all confusing. Sorry. There's almost 20% who are uninsured at any given time, and these are people who are not covered by government programs. There is Medicaid and Medicare, but there are a lot of people who fall through the cracks. If you look at Dane County, the numbers are very similar to the state of Wisconsin as a whole, maybe a little bit better. But if you look, 4% of people in Dane County have Medicaid or medical assistance, and more than that, 6% are uninsured at any given time. And this was a recent article from last spring in the Capital Times about the long wait at the free healthcare clinics. I've been in Madison for about 6 years. I did my residency here, and I've volunteered in some of the clinics they have to help poor people. There are specialty clinics, really, as far as primary care and prevention. There's not much. There's Access Community Health Care, which treats people on a sliding scale fee, but there's quite a long wait to get in to be seen there. There are several clinics put on by the medical students, which are a half a day a week, and really don't see that many people, and they try and get people hooked up with a regular physician, but it's a stopgap measure. So we would like to help be part of the solution for this. As you can see, there is a need, and we certainly aren't going to solve the problem, but I think we can help a great deal. What we would do when people come to Our Lady of Hope Clinic seeking free care, we would screen them and make sure they aren't eligible for government programs. We would see them the day they came in, but if they're eligible for a different program, we would get them, help them fill out the paperwork and help them get access to what they should be getting. And we would reassess this annually. There is a little bit of a difference between the benefactors and the recipients. The benefactors can have access to us all the time. Our recipients will be our regular patients. We will see them on a regular basis, but they are walk-in patients only. And as I said, this is a small solution to a very big problem.